Serious, what was the most terrifying thing that you've experienced while staying in a hospital? I was strapped down and on a ventilator. I woke up and I was on heavy drugs, so I kept thinking I was in a very bad dream and trying to get out. I only did that a couple times, but I remember having to be told it was real and not a dream. Whatever I think is real is the dream. And after a few seconds it would clear up. I was in a car accident with my mom back in 1999 here in Texas. A large van ran the red light at a four-way intersection and T-boned us. The accident was so bad they took us all by ambulance to the emergency room. The people who hit my mom and I were in the room next to us. The woman was heavily pregnant but explained to the doctors something felt off for many weeks, but that her doctor in Mexico said the baby was fine. The ER doctors did an ultrasound and determined her baby was dead and that it wasn't due to the accident. They figured the baby had been dead for weeks. I'll never forget that woman's screams. It was heartbreaking. It was a mixture between heartbreak and disgust. She kept screaming, "Get it out of me, get it out of me." I'll never forget that moment. Was about 12 years old, got bit by a poisonous spider. In ER for it. The guy in the next curtain was apparently shot and stabbed with knife still in him. Nurses opened the curtain, didn't realize me and my dad were in the next area over, and so I saw a guy scream and holding in a knife in his gut. When I woke up in the hospital, buckled to the bed and didn't know why I was there. Happened more than once because it was for a brain injury and I couldn't remember why I was there, so I kept trying to escape. They ended up writing on a whiteboard at the end of my bed that I'm supposed to be there and stuff. I had intestinal surgery when I was about 13. Recovery was about 7 days to be sure that all the plumbing was working properly. Well, about the 5th day I had woken up to a fairly large wet spot covering my crotch and gown. Turns out I had a wet dream and was still unable to move easily to clean myself, so I had to inform the nurse. I know it's not much compared to these others, but to a 13-year-old it was a nightmare. As a child I was hospitalized a lot due to heart issues. One day I was out in the halls waiting for the playroom to open up. I was about 8 at the time. There was a girl on my floor who walked with a huge machine that pumped her heart for her. She was walking around too with what looked like her mom or older sister. Suddenly her machine started beeping. The nurses rushed. They were speaking German since this was a Berlin hospital. I don't speak German, I'm Russian. The look on her face before she collapsed was absolutely horrific. Her eyes went almost blank and her lips were starting to go blue. Still haunts me, never found out what happened to her. When I was 7 I was diagnosed with appendicitis, got my surgery and were out in a room with another kid that went through the same. He was operated twice because his wound opened. A day or so before leaving the hospital, he was taken away for another operation. I didn't understood nothing, but in my inner self I knew something bad happened. I didn't know something else about him until I met him again in a park a couple of years later. For me it was really awkward, as I pretty much forgot about him. My wife used to work as a psych nurse at a hospital in the city we lived in. She was on the floor on the 4th of July about 10 years ago. I get a call from one of her coworkers telling me she'd been assaulted by a patient. She took a pretty good sucker punch, and was down in the ER to get checked out. Well, I'm with a couple of my friends, and we all head in to see how she's doing. We're sitting with her as she's laying in one of the beds, when we hear this awful wailing. We turn around, and there's this kid. Maybe mid-teens? I can see the blood on his arm, running down and straining his clothes and the gurney. Turns out, he had blown his hand to shreds playing with fireworks. The screaming was extremely unnerving. My wife was okay, but that poor kid was not. When I was 16 I went with my boyfriend to meet up with a few of his friends down at the river. They were fishing and letting off fireworks. One started letting off bottle rockets. He was at the edge of the water. I was sitting back and behind him with my boyfriend. Somehow when he aimed it up and over the river it ricocheted off a tree and smacked me right in my left tit. I screamed like never before. It got stuck in my top so it burned me pretty good. I almost looked like I had 3 nipples after that. I was 4 when my tonsils were removed. I had strep every month for weeks at a time as a toddler. I remember being separated from my mom for what felt like forever, probably only like 15 minutes or lol, before the surgery for prep, and just screaming the entire time. I'd never seen an operating room before, or doctors and nurses with the entire PPE getup. I thought I was being abducted by aliens. So many damn bright lights. I woke up alone too, and terrified at the realization that I couldn't speak. I just cried and whimpered in my little crib-like hospital bed until a nurse wheeled me to see my mom in the recovery room. I was so relieved to see her that I threw up as soon as I laid eyes on her, lol. Which is also just something you do immediately after that procedure, I came to find out. My mom held onto me for the entire day while I ate ice cream and popsicles in her lap. What a day. As a young adult I was hospitalized due to sepsis. I was in the hospital for a few months. The first day I was transferred to a new hospital I heard this loud terrifying noise outside my door late at night and the ground started to rumble. I was in Florida so an earthquake was practically impossible but I had no idea what else it could be. I sat paralyzed in my bed, heart pounding out of my chest. I finally worked up the courage to press the call button. You can imagine the chuckle the nurse had when she had to tell me it was just the floors being cleaned. I was panicked. It really wasn't that bad but I was 5 and very scared. It was after waking up from anesthesia after having my tonsils removed. Due to a genetic thing painkillers or anything anesthetic doesn't really affect me. So I wake up and I am in a huge amount of pain, I'm surrounded by strangers and I can't talk. And then I see the bandage on my arm from the 4th and start crying. It felt like forever until my dad and mom were there. But definitely being alone, in pain and unable to voice it was the scariest thing for me. Not really terrifying but it could have been bad, but a few years ago I had to go into the hospital because I injured my hand. I thought it was broke, thankfully it wasn't, but I was there for several hours. What was terrifying about it was the hospital was completely packed. In fact I couldn't even get a room or office. I was treated in the hallway, and as I was waiting, they put chairs out there for all of us extras. I saw some of the local EMTs hanging out. I got to chatting with some of them, and I found out they were stuck there too. I asked why. It was because the hospital was so full they ran out of beds and they needed the gurneys, and they couldn't leave until they got one back. I asked them what would happen if there was an emergency and they needed to transport a patient now. They hung their heads, just replying let's not hope it comes to that because they had no gurney for them. Worst comes to worst they'd have to call another city to see if they had some, which would increase their wait time for pickup. The horror of seeing the budget cuts and the overcrowding situation in the hospital was sad and frightening. I was glad for my own sake that I was able to get out, relatively, quickly, well, at least outpatient, and didn't have to stay there overnight on a chair or gurney at the possible expense of someone else possibly not getting the chance to be transported because they couldn't. That was scary to think about. Apparently it happens a lot in my area. Hearing the doctor say, there is nothing we can do to save her. And then looking over and seeing tears coming out of my mom's eyes. She was intubated. Knowing she could hear everything but couldn't respond to us is something I still struggle with. Shit, her death is something I still struggle with. I love her and wish she didn't have to go the way she did. May not be scary but knowing I would no longer have my mother anymore was pretty terrifying to me. I remember when swine flu was the relevant pandemic. I was 7 months pregnant at the time and early one morning woke up so violently sick and struggling to breathe. I was usually very fit and healthy. I passed out on the bathroom floor and came round to paramedics moving me. I felt just about fine when I came around, was chatting away in the back of the ambulance, insisting it was just a funny turn and only the husband panicking. I was deathly pale but my obs seemed fine but they were insistent on taking me to get checked over. We get to the hospital, I'm put in a side room on a bed, obs are again fine and I'm just impatient to get home but they still want to observe longer. I feel a little bit lightheaded, so I lay down. I start shivering, but any sort of movement to call the nurse felt like I was going to be sick everywhere. I started to have these weird visions like the hospital bed being on top of a really snowy mountain, climbing it, then crashing through the roof in a big jolt back onto the bed hearing the heart rhythm on the machine all the while. Through all this I look at the machine but it's like I've gone too cold to move and it felt like I was watching it go slower and slower. It probably went by in moments but it felt weirdly peaceful like I was letting myself go and as my eyes started shutting I'm being shaken and shouted at and it's like I'm crashing back down to the bed in a jolt. I know the trolley's being wheeled along the corridor but it seems so long and wide and it's like I'm trying to keep up with it but keep losing sight of it. Everything to go black and my name being called and finding myself back on the bed looking up at a nurse then each time falling off the bed out of my body but it's like with each time my name's being called someone's picking me up from a big height and throwing me back down into the bed. Then I woke up in intensive care in one of those swine flu rooms. After being on the resus ward for 10 hours. I didn't know where time went at all All of the above seemed to happen in the blink of an eye almost. It wasn't swine flu. My bloods, everything was fine. They couldn't say what caused it, but I was literally put on complete bed rest and fitted with a catheter for a few weeks to prevent whatever was causing it happening. It's still a mystery, but I certainly would have been dead now had I not been in hospital at that very time. My baby was absolutely fine. I went to the ER 3 months ago for seizure-like symptoms. Turned out to be convulsive syncope and pretty treatable with an adjustment of my medications. However, I've been in medical lockdown this pandemic because my asthma is out of control. My doctor, at my appointment over the summer, stared me down and said, "You can't get sick, do you understand? Your lung functioning can't drop any further. You have no wiggle room left, but seizures are an emergency, and could mean something bad, like a brain tumor." So I reluctantly went to the ER and sat in the waiting room. 10 minutes later, a COVID patient comes in. She announces to the front desk that she's been diagnosed and is having trouble breathing. She's instructed to take a seat and wait. Now, with all the social distancing, there's limited seats available. The only one left is one exactly 6 feet away from me. There's no place left for me to go, so I listen to her cough and wheeze and struggle to breathe for half an hour, absolutely terrified that I was going to catch the virus. I got called back for some tests and was given a bed in the non-COVID area, but it was in the hall. The hospital was so full that all of us non-COVID patients were crammed together in one ward. I was right by the doors that led into the COVID hall, and got to watch doctors in full hazmat suits walk around. I kept thinking it looked like a movie in there, and then a trauma patient was brought in and wheeled to an observation room. The curtains were pulled, but it was one of those glass-walled rooms, so you could still sort of see in. There were a lot of nurses and doctors running in and out. And there was a lot of blood. It was sort of pooling on the floor. The patient was yelling, not screaming, but making those deep, loud, animal-like groans that says they don't have the air or energy for a full scream. And all of us, stacked up in beds along the wall, tried not to look, because it felt like we were witnessing something private. But those groans, they carried across the entire ward. It was terrifying. I could see some of the other patients trying not to cry, and to the other side of me, right over the cubicle wall, a nurse was on the phone talking about insurance and medical bills, and sounding bored and robotic, like she'd answered all of these questions hundreds of times before. It was absolutely surreal. I got out a couple of hours later, but the entire experience was just... I still can't find the words to describe it. I'd never been so afraid in my life. Afraid for myself, afraid for the patients, afraid for the doctors. Just afraid for everyone going through it. When I was between 3 and 4, I had to have emergency abdominal surgery for a blockage. The scariest thing I've seen was either my parents having to stop at the double doors that visitors can't pass, as they hurriedly rushed me to the surgical area. Mom crying on Dad's shoulder, Dad looking very concerned. Or, the guy they wheeled next to me and prepped for the surgery. Back in the 70s they didn't care about privacy and there weren't curtains between patients, at least not in the surgery prep at this hospital. The guy next to me was an elderly man, unconscious with tape all over his face. I have no idea what the tape was for, probably just to hold an intubation tube or something, but in my mind it looked like they just carved his face up and used tape to put it back together. Scared the shit out of me. I didn't know what they were going to do to me, if I would look like that guy, etc. But shortly after that they gave me the happy gas and all was good. It wasn't terrifying but the most awful thing I've ever felt. I had a drain put in after having my gallbladder removed and the next day the nurse came in to take it. That things was in there about 6/7 inches, right up into my stomach, and she just slowly pulled it out. Oh, I still shudder thinking about it. I was staying in a low-security mental ward. I had let my insomnia get the better of my life and mental health and absolutely had to be admitted to get my medication and sleep schedule back to a productive place. While there, you get to be friends with other people doing long stays. I became friends with a guy that was a little bit younger than me and didn't really think anything of it. However, this guy started to become a little unhinged, and really started only focusing on me. It got to the point of where he was waiting for me outside my room all the time, eating what I was eating, stuff like that. Hey, maybe I'm being a good example because I'm getting better and he wants to do the same. Nope. Turns out, he had paranoid schizophrenia and thought I could cure him. It came to a head one day where I was trapped in the rec room with him until our doctor could come, since he would literally freak out if I left his sight. The last time I saw him, he was being escorted to the high security ward, mumbling my name over and over again. He wasn't breaking eye contact with a cold, unnerving stare, and he held an outstretched hand towards me as the double security doors closed. I think about that stare when I don't prioritize my mental health and get the shivers every single time. I spent some time in a psych ward as a kid. It was a bad place and pretty abusive. One of the staff members broke another kid's arm, and I remember hearing the boy screaming as it happened and afterwards. It was scary, especially because we had no agency between being kids and psych patients, so the staff had total control. In the ER and was given an 4 push for pain and left alone in a treatment room. I had a bad reaction to the medication, found out later. I can't have any form of opiates, real or synthetic, as I have a bad reaction. In short, I tripped off, while bleeding heavily, and whatever they gave me seriously slowed my HR and my BP tanked. I'm not sure what was more terrifying, being fully conscious and aware in a body that is slowly shutting down, or being convinced there's a 7-foot-tall shadow demon standing at the foot of your bed to take you to hell when it's over. Does a mental hospital count? On my 3rd day there, my then new friend cut open her wrists and ran out of her room like that. There was a lot of blood and screaming. I was so scared and wanted to go back home immediately. Couldn't sleep after that because every time I closed my eyes I saw her with her arms and the floor covered in blood. I only saw her for a few seconds before one of the therapy people came and helped her, but those few seconds were May. Honestly. The robots. This was before they were everywhere. I wasn't staying in the hospital but had gone to visit a relative, and when coming to a crossroads in the hallway here came a moving box about the size of a mini fridge. Nobody around it. Beeping and playing a recording. It wasn't moving fast but it was headed straight to me. Quiet creeped me out so much, maybe because nobody was around gave it a dystopian feel, or because I had no expectations of seeing a box high-pitched beeping towards me. From what I remember, I was told that the robots deliver things around the hospital like medicine and small stuff. I'll admit I backed around the corner to find a different way out, then quickly picked up my pace when it rounded the same corner and followed me. Toward the end of my father's life, he had terminal cancer. We had to take him to the emergency room. We got him checked in, and as we're waiting for him to be seen, we hear several ambulances. Without going into too much grossness, there were 3 teenage kids, and they were kids, that all shot each other over some argument. So much blood. I had just never seen anything like that in such close proximity. All I kept thinking was that these boys had mothers and fathers and siblings. They were rushing all 3 in for surgery, but I doubt any of them made it, and if they did, there had to have been permanent consequences. I hope I'm wrong and I never did find out what happened to them, but man. That was some crazy, disturbing shit. Alright, this isn't that bad, but probably when I walked into the room to see my hospital roomie crying after the doc told her something, I felt so much dread, or it could be when I was told my vital signs were effed, what landed me in the hospital in the first place. I had a surgery and it was planned for 1 p.m. It's a 4 to 6 hour surgery, and recovery of about 2 to 4 hours before being discharged. I was a teenager, so my parents took me in. They wanted me in at 9 a.m. Lord knows why. Mind you, no eating since 8 p.m. day before. Surgery gets pushed back until 4 p.m. About 20 hours with no food or drink. I was in shape, but I was feeling rough. Surgery goes well, but my body was exhausted from the lack of nutrients and surgery. It was super late, and my mom and dad had headed downstairs to get some food now that I was okay and in recovery. Nurses said I'd be out cold for at least another hour. 2 things my parents didn't know. 1. I woke up during surgery. Made eye contact with the anesthesiologist. I try to say, "Is it over? Why am I awake?" But it's muffled from the breathing assistance tube. She freaks out, says, he's awake." Like really awake. I begin moving, not by choice, and they're holding me down trying to keep me still as they have me cut open. They got me back under. 2. I woke up like 5 minutes after they left. It's dark, I am alone, and it is silent. I mean pin drop silent in the room. I get up, there's no monitor running, nothing on me. I am hurting, but I begin looking for a nurse, anyone. It's dark in the hallway, I can't find anyone. Now I'm getting spooked. I start weakly asking, "Is anyone there?" Finally, after what seemed like an eternity and the beginning to a horror film, a nurse yells, "Oh my God, baby, what you doing out yo bed?" All ended up fine. I mean, I learned muka later. Me waking up and moving caused the surgeon to nick an artery and cause a ton of bleeding. I'm still here, so all well that ends well. After going out to drink one night and having not much at all, I blacked out. I was either drugged or had a bad reaction to hops, still not sure. Next day, I threw up non-stop for about 14 hours. When every muscle in my body was cramping bad enough I could barely move and my heart started acting real funny, I called an ambulance and went to the ER. They did every sort of test, gave me the runaround in a million different ways. But that wasn't the scary part. My parents had come, and the three of us were sitting in the room. At this point I was fine. In walks a doctor. He come in, says, "We got some tests back. Your white blood cell count is a little high. It could be leukemia," and then walked out without another word. They ended up shipping me off to another hospital to figure out what was going on, and my dumbass agreed. Other hospital was super confused. Basically said you can throw up until you're dehydrated enough to not be able to hydrate yourself again, and I was perfectly fine now that I'd been rehydrated, but that moment where we were sitting there contemplating the fact I may have cancer in my blood. That was terrifying. I don't have leukemia. I probably just have a hop intolerance. I work in one, but when I had my son years ago a lady came in and picked him up saying she was a nurse. I was very drugged up and couldn't move, but my ex came in and she said she'd be back. No one knew who she was. It still gives me the chills. I was in the hospital following a motorcycle accident and subsequent surgery. My roommate had been in an 18-wheeler accident. He was complaining his back itched and someone finally rolled him on his side and his back had pieces of glass stuck all over. I still don't know how the hell that was overlooked. Then his x-rays came back and showed a broken pelvis, so they put him in traction and the weights would pull him part way off the end of the bed every few hours. That's not terrifying, but I was stuck in the hospital a while and it kept me entertained. This probably isn't the most terrifying thing compared to some others, but I have pretty extreme needle phobia. I was scheduled for surgery on my hand, and when the nurse, or whoever, came to put in my four to knock me out, she missed my vein several times. She called someone else over to try and the second person also missed my vein several times. With every missed stab, I was getting more and more frantic. My dad was holding my hand and he said I was basically squeezing hard enough to break it and my face was changing colors. I was hysterically crying, flailing around, my heart rate was through the roof. My dad angrily yelled at the nurse to get someone competent to put the fourth in. I think it was the anesthesiologist that came over. Thankfully he got it on his first try and I was knocked out and wheeled into surgery a few minutes later. When I was about 10 I went into a diabetic coma, and they allowed the intern to practice his four placements on my passed out body. He did such a bad job, it hurt so much I'd gain a bit of consciousness, berate him for his non-existent skills, and pass out again. Multiple times. After many tries he promised me it would be his last try, and if he didn't succeed he'd get a real doctor to do it. I told him I had no confidence in him. I was right. He cried, and went and got that real doctor for me. Almost all my life I spent in the hospital, but the one moment I'll never forget is when I was in the emergency room bed getting in for and a mother came running and screaming with her small child in her arms. All the doctors and nurses immediately ran to help her and to get the child attention. The mother was screaming, "Help me please," in such agony I felt even more nauseous than I already was. I don't think I can ever forget her screams and seeing this tiny little child wrapped in a towel looking blue. I think the baby made it. At least the mother stopped screaming and calmed down and went to the waiting room. I can't even begin to imagine the horror of holding your breathless baby. My mom was in the ICU after surgery to remove a glioblastoma brain tumor. My dad, aunt, uncle and I are all gathered around her bed chatting when suddenly a nurse goes running down the hallway outside. Nurses never run in hospitals unless something is wrong. We all kind of looked at each other. I looked back at the doorway just as an elderly man in a hospital bed was wheeled by, and locked eyes with him for 2 seconds that felt like way longer. I can still remember his face and eyes. They put him in the room next to my mom's and all hell broke loose. Alarms are going off, nurses and doctors are appearing out of thin air, and the whole hallway is full of people and machines on carts. His family was in the hallway screaming. They worked on him for a long time and finally called it. We were literally trapped and had to listen to the whole thing because we didn't want to push our way through the hall to leave. I know nurses deal with this every day. Y'all are heroes for real, but that's the first and only time I've seen someone about to die and it had a big impact on me. My friend broke her hip in 9 places, and a lot of other bones, but that is irrelevant to the story. She was getting prepped for surgery and a surgeon in training rolled her onto the hip that she shattered. All her body weight went straight into her hip. My friend screamed in agony and ended up seizing due to the extreme pain. That surgeon did not operate on her. I had hepatic encephalopathy, which means I was basically insane due to ammonia buildup in my brain. I couldn't make coherent sentences. I didn't know who I was or my wife was. I did compliment her by saying she was a hot nurse, though, surprisingly, that's not the worst part. The most terrifying part happened as I started to get some of my memory back. I kept thinking I was saying I had 5 kids, which is true, but my mouth was saying I had 6 kids. To which my wife was responding, "No, you have 5 kids," and my brain heard, "No, you have 4 kids." So for about an hour I was panicking because I thought one of my kids didn't exist or ceased to exist or something. I wasn't exactly rational. But it was terrifying, and as I continued to get better I would make sure we had the right number of kids, would repeat their names and their birthdays. I was in the hospital with a broken left ankle and fibula and a severely sprained right ankle. It was around 4 a.m. and I heard code blue pediatric ER, code blue pediatric ER. It was very eerie hearing that in the dark and just made me feel really sad at the time, thinking of the poor parents potentially watching their child die in front of them. As a parent myself now, it makes me even sadder to think about. When my appendix burst I was in the hospital for about a week after my appendectomy to make sure the infection didn't spread too far. Anyways, I had one nurse. He kind of gave off Cholo vibes. Big Mexican guy, he came in and was pretty cordial. I had no issues with him. Anyways, one night he came in to check my vitals and do all the routine stuff he needed to do with me. I was asleep and I don't think he wanted to wake me, so when he came in he kept the lights off and tries to be quiet. I woke up and noticed someone next to me in the dark, so I panicked a little bit and jerked up slightly. I think I must have scared him too, cause I sensed he panicked and put his hand on my chest to hold me down. Luckily I was able to figure out it was just him doing his thing, so I relaxed, but for a second I was just like, WTF's going on? My first memory, it's pretty vague, is from when I was 4. I got appendicitis and needed intimidate surgery as my appendix was about an hour away from bursting. I didn't understand all of this at the time, but from the perspective of 4-year-old me I was even more terrified than I would have been if I did understand. I remember my mom taking me to the ER. Luckily it was fairly empty and we saw the doctor in about 30 minutes. The doctor said nothing was wrong and I probably had food poisoning. My mom told them to do a scan and they finally agreed. The scan was terrifying, and because I was so scared and wouldn't stop moving I had to be strapped down, which of course made it worse. By the time the scan was done my grandparents and brother had arrived and were in the waiting room. From then I just remember them putting me on one of those bed things and rushing me to the operating room. We passed my family on the way and I could see my grandfather crying, which I had never seen before, and haven't since, and so I knew this was bad. My mom was able to follow me to the door of the operating room. For probably 10 seconds after she let go of my hand I was reaching out to her screaming for help and we were both crying. Then one of the doctors put her hand on my shoulder and gently lied me down and I fell asleep. I don't remember anything after that, but it's still one of my worst memories to date. When I was about 12 I was in the ER for some dumb little ingrown nail removal or something and we were waiting for the doctor a really long time. While we were waiting there were these, anguished screams coming from some other part of the building. It lasted a long time and I remember my mom suggesting it might have been someone on drugs. The removal happened and we were walking down the hallway to be released and I saw the mom and brother of one of my good friends in middle school. They seemed really upset, so we walked up and asked if they were okay. Turns out those anguished screams we had been hearing were from my friend who had accidentally fallen into a campfire while chasing his younger sister around. He lived, but he had to have skin grafts over a huge portion of his body. It was awful. Maternity ward. Women in labor, new babies crying. I stepped out of the room to visit a vending machine or update family, I don't remember which. Directly across the hall, in an open room with the lights off, was a new dad cradling his newborn. He was crying, and it looked like such a nice moment. As I went to leave the ward, I overheard 2 nurses discussing him. His baby was dead, and the mother was in surgery and it wasn't looking good. I'll never forget that man. I don't know how he had the strength to hold his dead child while surrounded by the sounds of new life and healthy mothers. I'll never forget how callous it was for the hospital to put him there. In that ward, for that purpose. Not terrifying but incredibly insensitive and cruel. Giving birth. I lost a lot of blood. I was lying in bed and feeling really weak and cold when someone from the staff came to check on me. I asked if that's what it feels like to die. She didn't seem to take it seriously until she had checked some stuff, at which point she got others there, and then last thing I remember is them putting some mask on me. Thinking I was going to die. Reading the journal, it was initially estimated to be 0.8 liters blood loss, but it was more than double that I lost. If she had checked on me later, I probably would have lost more blood. I don't know if it's terrifying, but I was in the hospital 2 times because of liver problems and 1 because of a broken leg. This didn't happen to me but to the persons in the bed next to me. English is not my first language, sorry if it's not descriptive enough. First one, I heard that the guy went to the hospital because of urinary infection. It got so bad that they operated him and removed part of the scrotum, and the nurse had to clean the area 2 times a week, one with general anesthesia. He got put to sleep and the nurse worked on him the second time with local anesthesia. I never saw him because of the curtain, but it sounded like they were working with sandpaper on a piece of wood, and the screams made me lose my sleep for that night. Now if I see or feel anything weird down there, I got straight to the doctor. Other time, an older man that the doctor just removed part of his foot. He had diabetic foot, and it was the second time. The first time they removed a part, but it seems that he didn't take care of himself, so the infection continued. This wasn't as terrifying, but when I was there because of the broken foot, I saw a lot of people with diabetics and most of them didn't took care of themselves. The husband of one woman was smuggling her candies, and 2 times the nurse had to inject her with insulin because the sugar spiked on her blood. The last one was just a couple crying outside a room. Their daughter just died. Never knew the reason. It was at night. I tried to sleep, but when I opened the eyes they were still there, sobbing and hugging each other. Almost 7 weeks ago to the day. My wife was being taken away to prep for a C-section. They put me in scrubs and tell me they'll come back for me in a few 5 minutes. After they leave, alarms go off and a voice says code red north lobby. Another 5 minutes go by and nobody comes to get me. I'm sweating bullets, thinking the absolute worst. I'm fixing to puke, I'm so anxious. Finally, a nurse comes and gets me, and escorts me 10 feet down the hall. C-section went beautifully, and we've got a wonderful baby boy. But for 10 minutes, I thought the 2 people I cared about most had died or some shit. So I went to the ER because I was vomiting uncontrollably, couldn't keep liquids or anything down, and there was a snow/ice storm about to hit and didn't want to wait in case the dehydration forced me to go in. I wasn't really worried because this has happened to me before, so I figured it would be business as usual and they'd run some tests and give me antiemetics and be on my way. A doctor/nurse, don't remember which, came in shortly after my blood test and told me my white blood cell count was extremely high, like 3x what's normal, and they needed to take blood cultures and that they were admitting me to the hospital. No one actually explicitly told me what was wrong, just that I had an infection in my blood, which obviously was scary, but I had no frame of reference for what that really meant. I asked every single day for 3 days when I could go home, meanwhile being pumped full of hardcore 4 antibiotics. Day 3 and I was chillin' in my hospital bed and I took a deep breath and suddenly realized that I wasn't actually breathing well before. I smoked a lot of weed at that time, so being winded/short of breath didn't faze me that much. So that realization was pretty scary, but I still thought that it was from smoking, and since I obviously wasn't toking in the hospital, my lungs cleared. Then the docs tell me I'll be having a PICC line put in and be set up with a home nurse to do 4 antibiotics at home for 2 weeks. Yikes. Finally, I get discharged and I'm reading through my discharge papers. The official diagnosis was bacterial septicemia, aka sepsis. I knew what that meant, and that was very, very bad. I realized that the breathing issues were because my organs were all slowly shutting down. They also weren't sure how I ended up with the bacteria that caused the infection. I insisted it was probably from a really nasty case of food poisoning I had about 2 months prior, but they weren't sure. I got set up with an infectious disease specialist who checked me head to toe, literally, for any wounds that may have gotten infected, but I had none, so he agreed I was probably right. The wild part is that I really didn't feel that bad leading up to the ER visit. That saved my life. Like I said, I smoked and it was winter, so I assumed that I was getting winded from smoking and feeling run down because of seasonal depression on top of regular depression. But I survived. A little traumatized, but I'm still kicking. I've been through a lot as a patient. There's more than a few comments here I can relate to. Honestly, the most scary thing that ever happened to me in a hospital was a nurse bringing me medication in a cup and plunking it down demanding I take it. "It's your flagyl," she told me. "I don't take that," I responded. She was instantly annoyed. "If your doctor ordered it, he wants you to take it." I asked what condition it was prescribed for. She insisted I had to take it right now. I told her I wasn't taking it without knowing the reason it was prescribed, and I would be happy to wait until she was able to look that up for me in my chart. She made a huge show of being furious that she had to do this, looked up my record on the computer in my room, said not a single word and snatched it back off my tray table before stomping out in a huff. Not experienced by me, but when I was in pre-K, I almost lost my sister to appendicitis. She was in the 4th grade at the time, so almost losing her was traumatizing for me at the time. I can't imagine how it felt for her or my parents though. I posted once already, but I've worked as a plumber at hospitals often when I first started out, but here's my best story. I was a younger apprentice still learning how stuff works, working with one guy who is also my boss. I get to the job, which is to add a new drain line for a new surgery room, but the plumbing is in the ceiling of the trauma unit, the one where ambulance deliveries first come in. There's this thing called a HEPA cart that we work in to keep the room sanitary. It's basically a square bubble with a zipper door and a vacuum to maintain negative air pressure, and it goes up to the ceiling. I'm in there with my boss and he notices the drainage line we have to tee into is back pitched, meaning it was leaning slightly the wrong way so all the sewage and junk wasn't completely draining. He tells me to get a bucket just in case, but it's probably empty anyway. So I stand under him on the ladder and hold the bucket over my head expecting a little trickle of pee or sink water. Nope, the floodgates opened up. It was about 40 gallons of black diarrhea and old blood and toilet paper and everything else. It rained upon us and there was so much of it, it spread through the entire ceiling and leaked into other parts of the room. I am at first so shocked I don't know what to do and start immediately thinking I'm gonna die of AIDS or hepatitis. My boss hollers at me to clean it up. I go in all the cabinets looking for the paper towels and use rolls and rolls of it, but it's no use. Poop everywhere. All over the place. I mean, it was really bad. Cue the nurses and EMTs running in, dude unconscious on a stretcher, arm half blown off. Nurses keep saying amputation, amputate this and that as they get closer and the stench hits them. Absolute chaos. There's nothing we can do. People are flushing the toilets above us even though we put out of order signs on everything. The doctors and nurses kick us out. We say we have to close the line up or sewage will keep coming, but they kick us out anyway. I hope his arm is okay. I've got two that still shake me for different reasons. The first is the time that I had some minor internal bleeding issues that I was scheduled to have equally minor surgery for, and ended up hemorrhaging as a result of the pre-op medication I was given. I knew that things were bad just by how dizzy I felt, but I didn't realize how bad off I actually was until 3 nurses came running into my room. With 2 of them went running back out in opposite directions calling for help. The second isn't terrifying in the traditional sense but in the implications. I was rushed to the emergency room, not for the first time over the previous months, due to ongoing difficulty swallowing and breathing. I saw the same doctor as I had the previous time I had been taken to that particular hospital, and she treated me as though I were histrionic and suffering from an eating disorder. At one point, the doctor even said that the reason she wasn't in my room more often was because she had actual emergencies to take care of. After I was finally given a room, the nurse told me that said doctor had also instructed her to give me Xanax, a medication toward which I have a severe reaction. The doctor knew about this reaction. In addition, when I was released the following morning, I was given prescriptions for anti-anxiety medication and antidepressants and made to sign a paper promising that I would eat. As it turns out, I had mono and Lyme disease, which both cause issues with swelling in the throat, plus an incredibly nasty sinus infection. In labor with my daughter for hours and hours. I was in so much pain that I just knew I was going to die if I gave birth vaginally. My mother hemorrhaged horribly with all 3 of her children and I was scared of the same. I started to get tunnel vision and the world seemed to be fading in and out. 1 emergency C-section later, and I had a 9.11 pounds baby. My son fractured his femur during a seizure. It's horrible but can happen. Especially with kids with cerebral palsy who are non-weight bearing, like he is. He had to have his cast redone, because the top of it was digging into his thigh really badly. He's nonverbal and total care, so I asked for him to be sedated and monitored so he wouldn't be in pain and could relax. They were admitting him to the hospital, because they were afraid he had something else going on as well. Ortho decided against it, loaded him up with hefty doses of morphine and Toradol. They redo the cast and he's admitted. A day later they're talking about discharging him, but I'm noticing he's working super hard to breathe. Oxygen saturation is crap, like 89 to 90% on 4 liters of oxygen. They move him to the med floor, at a separate site, because of all the construction they're doing at the hospital. I didn't feel comfortable, because the PICU is at the main hospital and he's looking not great. He was a micro-pre-ME, he's 12, but has crappy lungs and I know him well enough to know when things look dicey. We get to the med floor and he absolutely tanks within a few hours. His respiratory rate hits the 50s, SOTs are in the high 80s, he's working super hard to breathe and has formula from 3 hours before sitting in his stomach. He has a G-tube, so I could see how much is in his stomach. He decompensated even further and I'm absolutely freaking out, fairly convinced he's about to end up on a ventilator. Thankfully, the respiratory therapist was phenomenal and basically took charge and got him the equipment he needed. X-ray showed an almost entirely collapsed left lung. They didn't move him back to the main hospital. Next night he decompensated even worse than the night before and ended up in the PICU at 1 a.m. because they couldn't stabilize him. First time since the NICU that I really thought I was going to lose him. He spent 20 days in the hospital, 18 in the PICU. Absolute scariest thing I've been through, besides his first few weeks of life. This came out of absolutely nowhere. Best guess, he aspirated while he was loaded up on morphine and collapsed his left lung. Never want to go through that again. Developed a blood clot behind my knee after surgery a few years ago. Was at the hospital when they found it, so they wanted me to stay until a specialist could check me out. Was in a bed for hours. Heard a lot of talking and preparation going on, but no one checking on me and was wondering what was going on. Hearing some of the conversation between the staff helped me piece it together. Once the patient arrived, I couldn't help but hear what was going on, between the staff, EMTs, and police officers. A young woman, 18? 20? I forget the exact age, with a history of psych issues stood in a kiddie pool in front of her house, doused herself with tiki torch oil, then lit herself on fire. The hospital I was in was definitely not equipped to handle burn victims, so they had basically the entire staff ready to help care for her until they could find an appropriate hospital to take her. From 3 or 4 beds away, I could smell the seared flesh. I could hear them pump her as full of painkillers as they dared, mostly through her feet. Pretty sure the only place they said they could put a needle was between her toes. And the whole time she was screaming bloody murder, as I don't think the meds helped much. I can't imagine what the burn unit she was transferred to looked, smelled, and sounded like. I've woken up in surgery twice. Nobody believes me, but I remember it very clearly. When I was 4 or 5 my urethra was bent and I peed straight up. Woke up in that. Then when I was 15 I had my second tonsillectomy. I woke up. I vividly remember the anesthesiologist shoving the mask back onto my face. When I was younger I had to go to the hospital to get a bad tooth removed. I don't remember anything from my stay except for one situation where I was in a room with 3 nurses, who were talking about something completely unrelated, ignoring me in the process, while my arm was held down on the table and they rammed a needle in my hand. I remember my mom holding me from behind in a supporting manner and me screaming and crying in her arms after, as she carried me back to the hospital room. Another splinter memory is getting infused something cold through the needle in my hand, so I'm guessing it was Info or something similar. I can't even remember the pain from the bad tooth and I've avoided needles ever since. Of course this was a long time ago and I was very young, so the memories might be exaggerated, but I tried my best to write it down in a rational manner. Being an EMT, I've seen a lot of stuff in the ER that people shouldn't have to see. However, one time when I was in the ER as a patient, the lady in the room next to me coded. My ER nurse jumped on her and began giving her CPR. Her heart started back up pretty quickly, just as he hit the code blue button. Several of the nurses and a doctor rushed to her room, but the one with the crash cart showed up in my room. She looked around like WTF, wondering where everybody was. I pointed to my right towards the room with the code and she quickly left. She coded a couple of more times that night and they moved her up to ICU to watch more closely. I'm just glad I wasn't asleep at the time or laying there with my eyes closed. Who knows what she would have done to me. When I was about 6 or 7 years old, my mom took me over to one of her friend's house. Her friend had a daughter the same age as me. The daughter loved to chase me. They had this metal screen door with a long broken handle. I remember it was very jagged and sharp. Well, the daughter was chasing me in the backyard and I decided to run inside as fast as my little legs could carry me to escape, so I barely opened the metal door and slip inside like the little ninja I was. Well, the next thing I know I'm flipping through the air, then darkness. I wake up to a massive puddle of blood and then proceed to pass out again. Apparently this broken handle caught me behind my left ear and almost completely removed it. It was barely attached by a single thread of skin from what my mom told me. My mom loses her mind and rushes me to the hospital. Apparently I bled everywhere and destroyed the inside of the car. I'm still knocked out when we get to the hospital and I'm rushed into surgery to reattach my ear. As they put the first stitch in, I woke up as soon as the needle went through my skin. 3 doctors proceeded to hold me down fully awake and sew my ear back on. I remember every stitch to this day. Every last one. I remember the doctor holding my legs down telling me to calm down little buddy, we are almost done, as I screamed. Apparently they waited too long after applying anesthesia. I have no clue why they didn't put me back under. I will never forget the pain in that stupid doctor. They told me my mom was dying and she was pale and she looked horrible. I was about to be 17 in like a month at that point. It's hard to go through that loss, but it's worse to be so young. She ended up fighting through it, but August, the year after, she died of suffocation in our home. Luckily I wasn't there. I'd have feel so guilty, but yeah, seeing your mom basically one step towards the light away from death at all times is pretty much the worst thing I can think of. I mean, she was truly suffering and it was very hard to watch her go through it. I grew up a completely healthy kid, but was oblivious of my family's health history. Out of nowhere this past January, I began having stomach pain that was diagnosed as ulcers. After 2 days of being on omeprazole, I began having attacks that would begin with the bottom of my ribs aching, then shortness of breath, and then horrific pain in my upper abdomen, mostly in the middle and somewhat to the right. These would happen randomly, and lasted about 30 minutes to an hour, but during them I couldn't do anything for the pain. No pain pills helped, no position, eating didn't help, nothing. But after the 30 minutes to 1 hour mark, the pain would just disappear and I would be fine. Went to the hospital when the first one happened, and they did an ultrasound and discovered numerous gallstones. Now, I'm 19, female, and in decent shape, so they were very confused as to why I had so many, but my gallbladder wasn't inflamed and they didn't see anything blocking any ducts, so they said that they wanted to treat the ulcer to see if that was what was causing the pain. Ulcer pain and gallbladder pain are incredibly different, so this was frustrating initially. For me, the ulcer felt more like annoying, constantly hungry pain. The other pain I was having was the worst pain I'd ever felt in my life, so for a week after, I had these attacks on and off, but then they seemed to stop. I was hopeful, and knew that if I could make it to 2 weeks, the full course of omeprazole, then I should be fine. On the 2-week mark though, I had another attack, and from there they only seemed to get worse. I called my hospital's nurse line, where they told me that to get evaluated I needed to be in pain for longer than 2 to 3 hours. More on and off attacks, until the early morning hours of February 17th. Ironically, the day I had a doctor's appointment set up with a primary care doctor, so that I could get the ball rolling to get my gallbladder out. Since everyone knew it would eventually become a problem, I woke up at around 3:45 a.m. in severe pain and immediately called my boyfriend, hoping that the episode would pass and it would be okay. But things got progressively worse, until I was laying on my bathroom floor, throwing up nothing but bile, unable to move or barely breathe. I'd never felt complete fear until then, and that was the one and only time in my life that I've ever called 911. I was taken by ambulance to the same hospital I'd been going to, given anti-nausea and fentanyl, and the pain subsided somewhat and I was even joking a bit back and forth with the imps. Once in the hospital though, the frustration began. The surgeons came and talked to me and made it clear that surgery was the best option, to get my gallbladder out. But then more doctors kept coming in, and courses of actions kept changing, and it felt like they were just trying to get me out of there. On top of that, the pain continued to come back, and they were giving me Dilaudid about every 2 hours. The first terrifying part was when a doctor came in and said that he didn't think my gallbladder was the problem. When I asked him what else it could be, he replied with, "Oh, you know, Garrett, acid reflux, heartburn." It felt to me that because I was a 19-year-old, alone in the hospital, with an ulcer, they were minimizing the pain I was in. And in tears, I told him that this wasn't heartburn, This was the worst pain I'd ever felt. I was terrified that I was going to be sent home to continue dealing with this pain that was hovering over me every day because this man didn't believe me. He said that he wanted to try a GI cocktail and a PPI inhibitor, to see if the issue laid with my esophagus or stomach, and wait to see if that helped the pain. So I took it. It didn't help, and he finally agreed that surgery was the best option. They scheduled me to have a laparoscopic cholecystectomy, after being in the hospital for 11 hours in disgusting amounts of pain. I don't remember too much after that, as I was taking more and more Dilaudid, but I remember them taking me up to pre-op and the pain getting worse again. They had to spend more time to find the anesthesiologist and surgeon to see if I could have more painkillers before the surgery, and then they gave me fentanyl. Thankfully, they were rolling me into surgery, because I remember the fentanyl not helping the pain that time. I don't even remember counting back from 10. Waking up alone after surgery was the second most terrifying part. I can still remember the pain I was in, even after the nurse gave me another round of Dilaudid, and how I could barely get any food down. After the painful walk to the bathroom and changing, I had to stop because I was going to throw up. For this, the nurse went and got a dose of anti-nausea through my fore and handed me one of those smelling salts from her personal collection. I did not feel well enough to go home, but it felt like they wanted me gone. And my days after surgery were miserable. Reading through my paperwork afterwards, I found that my gallbladder had been nicked during surgery, and I was subsequently irritated, which is gross to think about. I also read in the nurse notes that pain was managed well, was able to keep food down, and wished to go home, none of which was true. My recovery was painful and troubling, with them believing that one of my incision sites were infected, but then telling me that there was just nerve damage on the top layers of my skin from the surgery. I don't think I'll be going back to that hospital for anything else, and honestly, it scared me enough to not want to get any medical treatment. When I went to the hospital a few years back to have surgery, I was placed in one of the recovery wards for 3 days. I think there were 5 other children sharing the ward with curtains to separate us. There was this girl my age across from me who I could see when the bed was tilted up. She was a survivor of a car crash. I don't know what happened to her family. She was recovering from a spinal injury, so she couldn't move. Her eyes locked with mine. We stared at each other for nearly 2 days. Something about the pain and sadness in those eyes was unsettling, and I still think about her every now and again and what happened to her. I had fallen off my bike and shredded my shin on my 3-gear, the big one. I switched to 1. But when I was in the ER, some old man and his wife came in. His wife's white hair was red because of blood and was pressing a bandage on it. Later a guy came stumbling in, hands dripping wet and blood, moaning, wincing at walking. I opened the door for him. He thanked me, then got help immediately. I could have sworn that there were 15 or 17 bullet wounds. They were a perfect size and looked exactly like some pictures I saw. Will never forget him saying, "Thanks, buddy," like he was gasping for air. When I was a middle schooler, I went to the hospital for some sort of psych evaluation since I was suicidal and, although I didn't know it, had depression. I was with a doctor for a while. We talked about why I was suicidal, etc. For some reason the other doctors refused to get my discharge papers. My upset mom got in a huge verbal altercation with 2 security officers while I was locked in a room alone for an hour. She threatened to call 911 and sue the hospital and was fighting 2 officers who were taller than her while I looked at her out the window. I was terrified because I had no idea what was happening, but not "oh my god, I am going to die" terrified. Looking back on it as an adult though? Yeah, I would have had a panic attack. Eventually the hospital let us go because they didn't want to deal with us anymore. Wasn't the only terrible experience I had at that hospital either, but it was by far the most terrifying. Maternity hospital. I'm in one birthing room having just given birth to my 3rd baby. Boy was a bit bigger than expected and went legs first, so it was challenging, but apart from me having to get some stitches, it went well. Baby healthy. So the doctors are having a sort of high five moment. When the alarm goes off in the room next door, there was another birth in progress and the woman's womb ruptured, or something like that. Extremely dangerous condition. Basically you go for emergency C-section as fast as possible. Everyone rushed over. I hear commotion, but that's sort of quiet, professional commotion, everyone doing their job but extremely fast, nurses running. I'm left with my fresh baby in my arms, knowing that next door, another baby is probably dying. They saved her and the baby. It was a lucky day. But for like 45 minutes I was waiting there thinking about the other mom and her baby. and also waiting for someone to stitch me up. Nurses having complete disregard for the patients. I have been in psych wards 4 times. The first 2 times I was in the youth ward with the kids and teens. A lot of the nurses completely did not care about any of us. Scares me to think someone would willingly go into a profession that deals with some of society's most vulnerable people with such disregard to them. However, just to add, the last 2 times in the adult ward were much better. Oh boy, here's my time. When I was staying in the hospital for my double lung transplant, I got pretty sick. I got lung failure in my sleep, which led to heart failure, which made my arms and legs retain a lot of water, so I was barely able to lift my arms and I was unable to walk. I had to get ECMO and be intubated with a trot, some chest tubes, and IVs and other lines. They had to be careful that I didn't aspirate things, so I couldn't eat. Fed via feeding tube that I had for about 8 previous years, and hadn't got the piece that let me talk. Every morning a nurse would clean me and change my dressings, but she, apparently the one I had one morning, hadn't gotten the memo that I had my feeding tube for years, so she kept trying to dress it. I kept panicking because they changed the dressings every 24 hours and I didn't want my feeding tube to be covered up for that long, because if it's not turned every once in a while, I was told it could make me pretty sick. When I tried to explain this to her on my whiteboard, she kept denying that it was true and continued to try and dress it, so I told her to wake up my dad, who was in the room, sleeping. She looked at him, seemed anxious, and said no. I think it was because I was still 17 and a minor, so she probably wrote me off as scared or something, so I'm making any frantic noise I can make at my dad to wake him up, as she's ignoring me, until finally my dad wakes up and I write down what I've been trying to tell her and he agrees. She finally accepts it and doesn't dress it. Told everyone there to never let me get her again. Lamau. During the birth of my second child. I'm a type 1 diabetic and I just had this sense about 34 weeks that she needed to be born at 35 weeks. My obgyn was awesome, but he told me he thought I could make 36. I had preeclampsia with both pregnancies, but there was a feeling I had and I knew it was time. Obviously I wanted to give her as much time inside as I could, but I was suffering and I had that feeling. I spent the first 3 days in the ICU having steroids to speed up Bub's lung development. Having diabetes and steroids don't mix, so I was on an insulin infusion to stabilize. I was feeling okay, and I got the operation time scheduled for 1:30 p.m. on Friday. Initially, I pushed back, because even though it's a planned C-section, you're still classed as nil by mouth in the event you need to go under. 1:30 p.m. would mean I was nil by mouth all night and all morning, which was not ideal considering the insulin needs and needing to eat breakfast and lunch. But I was told unfortunately there was no other time slot available. Morning of the surgery I am told to have insulin, and I mention my hesitance given that I was nil by mouth and was concerned I might crash and drop into a coma. And fast forward to 11 a.m., and guess what happens? My blood sugars drop dramatically and the nurses rush around to get a dextrose infusion into my poor, tiny little vein on the back of my hand. Well, the dextrose glucose is so thick, my vein collapsed. It was excruciating. My body went into shock and it felt like someone was infusing napalm under my hand. It ballooned up into this massive lump, think tennis ball sized, and eventually I was screaming so bad they relocated the fourth into the crook of my arm. I'm shaking all over, but as the pain starts to subside I calm down. An hour or 2 passes and my husband and mother arrive and I'm feeling good and ready to go into surgery to meet my daughter. Despite the morning's drama, my friend who is studying to be a midwife is with me. She's the only person allowed to attend as I get prepared for the spinal block. Hubby is waiting outside and will be let in once it's in effect. Only trouble is, because I have so much fluid from the preeclampsia and I'm swollen as hell, they have trouble getting it into the spinal column. I have the blood pressure cuff on the left arm, which hurts when it inflates thanks to the collapsed vein and pain from the dextrose infusion. They can't put it on the other arm, because that's where my foreline is, so for what felt like eternity, the cuff would inflate, I would start shaking from the pain, and simultaneously they would be trying to insert a giant needle into my spinal cord. The pain of that needle was something I only hope I never experience again. It felt like someone had live-wired my body with electricity, and every time it hit the wrong spot, it would shoot through my body like lightning, all the way down through my pelvis and into my legs. The pressure of the needle was like being broken in half by a bench press in the middle of my back. The anesthetist was a little bitch to me. He kept demanding I stay still when clearly I was not moving willingly. After an hour, my obgyn comes over and says I can't take much more and suggests I go under. By that point I was so broken and in agony I cried and agreed. My daughter was born while I was asleep, with the umbilical cord wrapped tightly around her neck 3 times. She had to be manually resuscitated for 5 minutes before she was able to breathe on her own. If I had waited even one more day, she may have suffocated in the womb. She spent a solid week in the NICU but is now a healthy teenager who likes to boss us all around. I came to in recovery and was pretty out of it for days. I had fluid in my lungs and was mostly in and out of consciousness for the first 24 hours. I was deeply devastated to miss skin to skin. It was the only thing I had on my birth plan and I missed it. I'll never forget that whole situation, but I am so glad I listened to my gut telling me she needed to be born ASAP. Even my husband said he would never question a mother's intuition again after that. If you made it to the end of the video, thanks for watching. Don't forget to like, subscribe and share, and we will see you in the next video.